Now, let's switch to another significant and even more clinically sharp-edged area where South Carolina is leading the nation in improvement, and that's in the treatment of heart disease. Let me ask Rick Foster. Come on up, Rick. Heart disease is the #1 killer in America, as you know. Every 25 seconds, an American suffers some kind of coronary problem, and most of them are heart attacks. 25 to 30% of those are going to be STEMI heart attacks that I mentioned earlier. They're the most deadly type. The right care for a STEMI heart attack is to get that patient to a cath lab, open that vessel, and relieve the occlusion so that we don't lose heart muscle. That's the goal. Our collective efforts in this state to improve heart attack care have resulted in us being one of the top 5 states in door-to-balloon time. And that has been a collaborative effort that includes a lot of different physicians in this state, and I wanted to introduce Dr. Foster to talk about that. Rick?
Thanks, Thornton. Good morning, everybody. It's great to see all of you. We still have seating available here in the front, so if you want to come on down, you can really see it and get the show. I am so thrilled I was able to take time from my primary job as Chief Crime Scene Investigator to be with you here today to join in this celebration. We've had a lot of fun with that. And I want to say very quickly about Mission 2010. You saw in the video I had a chance to be a part of that as well. And because I'm in the quality safety world, that table was the end of the gauntlet. So other than the 6 patients who went to the emergency room, my team got to see every patient that came through. And it was an amazing experience. That lady actually that was interviewed and I was talking to on the video was the first in line on the first day. And she was there like 9:30 or 10 o'clock the night before. So when she talks about people waiting in line for the iPod or the iPad, she was doing that same thing through a couple of thunderstorms that night, along with a number of other people, so she could be there first to get the care that she needed. And it was just amazing to see both the work of everybody there, but also the response of the patients and their families, and the number of people who had significant medical problems that needed care and got connected to medical homes. So wonderful example. And it's really amazing what we're accomplishing together here in South Carolina. How many of you are native South Carolinians? Please raise your hand. I figured it'd be a many of you. We're the been years. You know, we've been here all our lives. And the rest of you, the come years. That's my dedication to the Charleston world. And we've lived through all kinds of stinging comments over the years about South Carolina being not the first in the things we want to be last in, and the last in the things we want to be first in. And now we're changing that. And I can tell you, this is one of my proudest moments as a South Carolinian, to be up here to talk about what we've accomplished here in South Carolina already, and we're going to be accomplishing in the future. It's really making a difference. And you notice that Mission Lifeline, Mission 2010, the mission word's in there. And I tell people I'm in the mission part of my career. This is all mission work we're doing to really change our communities. And this phrase here at the beginning, I think, is important to kind of frame why this is so important. When back in the spring of 2007, we brought together all the hospitals who do interventional cardiac care. And one of the reasons we brought them together is we were facing potential legislation that would have been very burdensome on those centers. And in fact, some of those centers probably would not have been able to continue to provide interventional cardiac services. And we're very fortunate in this state. If I showed you a map, we have some of the best coverage around the state of any state, so that anybody who had a major heart attack would be within 90 minutes of an interventional center. And that 90 minutes is very important. That's kind of the golden hour and a half, so to speak. And we brought them together, and we were successful in stopping that legislation. In fact, the folks that were involved in pushing that legislation forward are now actively involved with our Mission Lifeline program. And we were able to make a real difference. When we brought together the EMS personnel, and this is part of the success story here of how we came together as a team across the continuum of care, this was a statement that was made, the first part of this, and it said basically, before it was like reading a great novel and not being allowed to read the final chapter. Think about this. You have EMS personnel around this state, and we have some of the best EMS personnel and paramedics in the country. And they were out in the field identifying patients who had heart attacks and many other things, strokes, and they'd bring that patient to the emergency room. They'd leave that patient there, and then they would leave to go to the next call, and they would never know what happened to that patient. And that was the last chapter of the novel. And you see the last part, this was being stated by some of the EMS folks. Now we are all writing the conclusion to each patient's story together. And that's kind of amazing what we've been able to accomplish. So everybody came together, and over the last 3 years, I think I can actually advance this. It's amazing. I'm going to talk about what we've been able to really see happen for heart attack patients. And I really believe that we have the strongest system in the country for heart attack care. I haven't been able to convince the South Carolina tourism industry to be able to promote, come to South Carolina to play golf and have your heart attack. We haven't figured out a way to get that in place, but I think it has great potential. In fact, it's very relevant because some of these cases are individuals coming to our state and having the heart attack while playing golf. And I'll talk about that in a minute. You see heart disease is the #1 cause of death, and you know this, each 25 seconds an American has a coronary problem, most often a heart attack. At least 25 to 30% of those are the severe type of STEMI, ST elevation heart attack, where you're talking about enough blockage in the blood supply to the heart that you really do need to get them, ideally, to the cath lab for intervention within 90 minutes. And you see about every minute an American will die as a result of a heart attack. And we're making a difference there. We've actually significantly reduced the death rate for patients with ST elevation heart attack. In fact, our mortality rate for the severest kind of heart attack is actually lower now than the mortality rate for the less severe type. And I think that's a testament to the fact of what we've done. Last year, more than 8,000 South Carolinians were hospitalized after suffering a heart attack. 440 heart attack patients in South Carolina died during their hospitalization. So getting to the hospital quickly as possible is a major factor in recovery. So it's very important what we're doing. Here is the vision of what we decided to come together. And again, all of those hospitals initially came together. Now it's a partnership of every hospital in the state, all the EMS agencies, and many others. The American College of Cardiology, the American College of Emergency Physicians, and of course the American Heart Association. And this is part of a national program where they're trying to have at the state level this type of system in place in every state. And we are one of the state leaders with this, along with North Carolina. All heart attack patients in South Carolina will have direct access to the best and evidence-based care in the timeliest manner possible. So no matter where you are in the state, when you have that heart attack, we're going to get you to that best care in the timeliest manner possible. And you see, we're basically, well, it depends on what you look at. I'm going to show you how you can use data to your advantage, but we have the second highest rate, let's put it that way. If you can see this slide, you notice the red line is the national numbers for percentage of patients getting from door of the emergency room to completion of their cath lab intervention in less than 90 minutes. We started this program in the second and third quarter of 2007, and you notice, interestingly enough, that blue line is South Carolina and how we started separating ourselves from the rest of the country as far as the percentage of patients that get the door-to-balloon time in less than 90 minutes. And actually, here we are. Minnesota, Maine, and Rhode Island are all tied for first. I tell people, Minnesota, there are times in the year it's so cold you can't leave your house, so you have your heart attack and nobody finds out until the spring. Maine and Rhode Island have about 100 people in each state, so how many heart attacks could you have? So South Carolina with 4.3 million people, we're at 92%. We'd like to be at 100%, but you notice that there's only one other state that's even in the 90% range, and then it drops down below that. So that's a major accomplishment that we've been able to do by working together. So what are we talking about? And I want you to make sure that you understand what we're thinking about here. And again, you notice on the left-hand side, one of the most important members of the team is the patient and the patient's family. We believe now we have a system in place that once that patient or the family member calls 911, it's going to work for them. Now we're going to back. The next step in Mission Lifeline is to go back and educate the public to say, when you're having chest pain, don't get in your personal vehicle and drive to the hospital. Your family member's driving you and halfway there, you go into cardiac arrest, they're going to have to decide, do I stop and pump their chest or just drive faster? That's why the 911 system's in place. But once you call that system, the dispatch immediately sends that EMS personnel and their truck out. And our goal is to have where pretty much across the state, they have EKG equipment on the truck, and not only can perform the EKG there in the field, at the home or the work or wherever they're located, and then transmit that EKG immediately to the hospital that can provide the intervention. And ideally, and this is happening now across our state, the EMS paramedic calls the STEMI heart attack from the field. They're the primary care provider, primary care physician, so to speak, for the cardiac cath lab team. And once they call it, the cath lab team is driving in to the hospital as EMS is driving in from the field. And that's how it works. It's an amazing system. And then they decide, again, depending on the situation with that heart attack, whether they go to the closest hospital or to the nearest hospital that can provide the cardiac intervention. And that's now where we're not just saying door of the interventional hospital to intervention of 90 minutes. We're saying from wherever you pick that patient up, either in the smaller hospital or out in the field, in less than 90 minutes. A couple quick stories as examples of that, and they're great examples across the state that we hear all the time. Cooper River Bridge run this past year. Gentleman's running the bridge, kind of at the peak of the bridge, starts having chest pain and drops right down the bridge. Has actually had a major STEMI and also went into cardiac arrest. Fortunately, there was a physician running nearby. I believe the gentleman was a lawyer, so I think that was probably an interesting experience in itself. You're on the bridge, you're thinking, okay. And EMS personnel were stationed there. From the point that they arrived there, which was pretty immediate, to identify he was in cardiac arrest, stabilized him, got a heartbeat back, got him into the cath lab at one of the hospitals there in Charleston in less than 90 minutes, total time. And that's getting through the bridge run and everything else. And that gentleman went home 2 days later. That's happening over and over again. Here in Hilton Head, a gentleman who's actually very involved nationally with the EMS system was playing golf and had a heart attack right in the middle of the golf game. And again, way less than 90 minutes, door to balloon, a point of evaluation to balloon, and out of the hospital in a couple of days. Now you have EMS personnel, the ED doctors, the cardiologists, the staff supporting them, all working as one unit, a coordinated team providing care. We now have cardiologists who are going out and doing training from EMS personnel at their headquarters. We have stories of the cardiologists when they hear that the STEMI care patient's coming in, they're out on the ramp saying, bring the ambulance on around to the cath lab. We'll take them straight in there. I want to tell you another quick story. Charleston is a great example of where all the hospitals have come together, and we're seeing that same thing in the rest of the state, and said we're going to create a common set of standards, protocols, communication systems. Everything's done the same. So when the hospitals in the outlying area, whether they call Roper or Medu or Trident, the system will be the same. And that makes a huge difference in saving time and saving lives. And one of the personnel from one of the EMS agencies was talking the other day, and we were actually presenting in another part of the state, and he said, we were trying to find ways to tweak that a little bit more. Every 5 minutes saves heart muscle. And once you lose heart muscle, you don't get it back. So we're not only trying to save lives, we're saving the quality of life. So that person, they leave the hospital in 2 days, a month later they're working, or they can go out and play catch with their son or grandson. So he said, we figured out that we could actually, if we undress the patient in the back of the truck, that was taking time in the cath lab. So if they had on work boots, and he said, one of my personnel said, that's not in my job description to be undressing the patient in the back of the truck. And he looked at me and he says, make sure that you understand, this is not about you. This is about the patient. He also said that if he had a cardiologist that said, I don't understand why you should be able to call that STEMI from the field, he was prepared to say the same thing. It's not about you. It's about the patient. And so I think that's the message we're hearing over and over again across the state. And now we're building on that system to improve stroke care, cardiac arrest in the field where we do the hypothermia, the therapeutic hypothermia. We have patients that are actually staying on the therapeutic hypothermia while they're getting the intervention in the cath lab. And my last story is the patient who wakes up after the procedure and they say, here was a success. He said, you have any problems? He says, I'm just horribly cold. I just said, otherwise I'm fine, but I'm just very cold. And they said, well, the cold was the part that allowed your heart to start beating again. So we're making a real difference, and you should all be proud of what's been accomplished with the South Mission Lifeline program and what we can accomplish in the future.
That is very exciting to see the collaboration among the professionals in the state to put the patient first and make sure the outcomes are what they could be. Let me ask a question. I want you to think about this with me. How many of you in this room have been to Greenville in the last 2 years? Raise your hand. How many of you have been to Charleston in the last 2 years? How many of you have been to Columbia in the last 2 years? So we're going all around the state. Each of you in your community worries about the quality of care delivered in your community. But I bet you don't spend a lot of your time thinking about the quality of care delivered in another community where you don't live. We rely on each other for that. And that's why it's important to have a collaborative effort as a hospital community. We want to know that wherever we travel in our state, wherever anybody travels, they're going to get the right care. That's why this kind of program is critical. the fact that your care in your hospital and your community is great does not protect you when you drive out of town. And that's what we want for every patient, including our own families.